All right, hello infant students. I am excited to talk to you today about our Module 6 quiz. So we're going to go over it. I'm going to give you a couple little breaks in between to see if you can answer the question. So today, again, Module 6 quiz for our infant class. 3 reasons that children in the United States are less healthy. Today, a lot of it has to do with portion size. To be honest, if you go in the United States and obesity is on the rise, we get huge amounts of portions on our food when we go to restaurants. Or if you look at a Coke can, it has like 2 to 3 servings. If you look at an individual size snack bag that we serve our children, it's 2 servings in an individual size snack bag. So also children tend to drink a lot of juice. We don't teach children to stop eating when they're full. There's a lot of, if we'll eat this and you can have dessert, not really a good plan. Parents really insist that they finish their food instead of just providing them with nutritious food all the time and letting the child decide when they want to stop eating. Fried food, junk food, processed food with high fats, all reasons. So in our questions, name one of those 3 and you will be good to go. All right. So the most common first foods for babies could be sweet potatoes, peaches, yogurt. It's a lot of mashed pureed foods that you're looking at. What you're wanting to avoid for babies, for infants, is cow's milk. Egg whites is where most of the allergies come from. Shellfish have a lot of allergies. Peanuts have a lot of allergies. And then, of course, honey actually for infants can cause problems. So that's what you're looking for. Healthy food habits in infants, it begins when you're starting to eat solids. And so some healthy food habits would be to limit juice. They can have lots of water, and that's great, but you're getting calories in juice without the fiber, and you're really trying to get them to like chew, move their mouth, all of those things. You do want to, again, encourage children to stop eating when they are full. Offer lots of water all the time, and really eat the recommended amounts of fruits and vegetables. Essential. So a couple of things about sicknesses would be ear infections are not contagious. You really would need antibiotics to remedy an ear infection. With the stomach flu, you're going to want lots of liquid because they're throwing up, so they could be dehydrated, so you're going to want to rehydrate as much as possible. If you have a common cold with a lot of congestion, so congestion is feeling full of mucus inside your sinuses, then what can happen is if you have a child who's sleeping upright, propped up in a car seat, propped up in a swing, then it'll let it drain down into their stomach. Your sinuses can either drain into your lungs or they can drain through your esophagus into your stomach. It's kind of one or the other, into your lungs or into your stomach. And if it's in your lungs, that's where the cough comes from, because our lungs don't do well with fluid in them. So when you prop it upright, and that can help as well. It also has the stuff not just sitting in the back of their throat that can cause that sore throat. And then finally with croup, which is a really bad cough, you're going to want to bundle that child up super warm and take them out in the night air. So we want to keep them warm, but the cold air can actually really help the cough. So that is what is the best thing for them. If you're thinking of alternatives under the age of 12 months for milk, for breast milk, then what you're looking for would be formula. Really, juice is not an appropriate alternative. Cow's milk under 12 months, not appropriate alternative in terms of in exchange for breast milk. goat's milk, any of that above. One of the reasons why is because formula and breast milk has the appropriate amount of iron in it. Iron is super necessary for the children. Actually, up to the age of 6 months old, a baby has enough iron stored up in their body to last until 6 months old, and it's the reason why after 6 months old most formulas change for before 6 months and after 6 months. And the reason why is because there's then iron needs to be fortified in that formula afterwards. Juices are high in sugar and don't really have that value that we're looking for. So it's the vitamins that are really necessary. Okay, so let's talk about some baby bottle tooth decay. Is not just seen in babies who drink from bottles. It can be found in any like a sippy cup, anything that happens if you're having a child have something in their mouth that's sugary. Milk is sugary, yogurt sugary, juice is sugary, and then they sleep or laying on their side. It kind of puddles in their cheek, and as it puddles in their cheek, then they get decay in their mouth on that area. So tooth decay can be caused from bacteria that's introduced into the baby's mouth from a parent, like the bacteria in a parent's mouth. When I share a spoon with a kid, that can cause tooth decay, which is technically what baby bottle, tooth decay. Also, when you share cups, when you lick your child's pacifier to clean it, the bacteria from your mouth transfers into their mouth, and that can cause tooth decay. So, as some of the symptoms of teeth breaking through the gums are going to be fussiness, irritability, loss of appetite, because my teeth don't feel well, so I don't really feel like eating. Also, they tend to drool more often than usual. The reason why that is because you've got there's swelling in the tissue of the gums, and when we have any type of swelling in our body, it's a sign that there's an injury. And so our body typically floods lots and lots of fluid right into that area. And so it's the reason why when children are teething, their nose runs or they drool a lot, because their body is flushing a whole bunch of liquid up to their mouth area to try to heal up that area. This is the tooth is breaking through right on that edge of the gum up here like this and is trying to break through. These tissues are all swollen. Ways to comfort a child: use a chili teething ring, gently rub their gums actually with a clean finger or with a washcloth. That can help. That pressure can actually relieve some of the nerve pain. To help appropriate germ prevention protocols, definitely we need to be washing our hands all the time after going to the bathroom, picking up your infant, preparing food, using hand sanitizer, potentially staying away from crowds, getting your child vaccinated, but keeping your baby inside for the first 60 days of life is not appropriate germ protocol. In the past, perhaps in the 50s, there was a thought process of not going outside, but honestly, that is a thing of the past, even in right now and today's date. And also, there was an idea of like, oh my gosh, make sure you keep your child bundled up. Well, we don't want a child to be cold, like physically really cold, but children don't regulate their temperature well. So if you're cold, then your child probably is cold. If you're hot, your child is probably hot. So they don't need to be any more bundled or any more cold than you are. So you want to be taking that from what they have. So I've got a question for you. In the last 24 hours, a 6-week-old newborn is feeling warm to you, and the child is acting normal, yet when they check their temperature, it's 100 degrees Fahrenheit. Should you take the child to a doctor? Like, what is the answer to that question? Give me a second to be thinking about it. Should you take them? Do you not take them? And if so, why? So, it's important, and the reason why it would be a yes is because the child is younger than 2 months old. Again, we talked about the fact that children do not regulate their body temperature. Any temperature under the age of, under like at 100 is considered a fever for a child, especially under the age of 2 months old. Really, when children have fevers, we really want to wait for that. We don't need to wait any period of time. Once the fever hits, it hits, and that's great. The 24-hour waiting period with a fever is usually related to when you're allowed to have a fever break, and then you wait 24 hours before you can go out in public again in terms of keeping others safe and not sick. Required immunizations. We've got polio, we've got measles, we've got whooping cough, and we have tetanus, all required immunizations, and that's related to your MMR, that's measles, mumps, and rubella. Your whooping cough, if you look on a vaccination card, is a DPT, but tuberculosis is not a required vaccine in the United States. So we get tuberculosis tests. That's where you have the prick on your hand and or your arm somewhere, and 2 days later you go back and you check to see. Child care workers are required to have tuberculosis checks every, I would just say, anywhere between every year to every 3 to 4 years. 4 years is the longest I've ever seen it. We don't have a standard for that, but working in any child care center with any child, the government does regulate. We have to be tested on a regular basis, and that regular could be anywhere from a year to every 4 years. For example, I have to be tested working at the district, and my test lasts every 3 years. And your test, if you are working in our laboratory setting, would be valid every 3 years as well. And you can get the test by the doctor, but in other countries, tuberculosis is a mandatory vaccine. In the United States, it is not. Vaccines, question. True or false, do vaccines provide 100% immunity against childhood illnesses? Of course not. No, they don't. A child who gets ill with a vaccine-preventable disease usually just has milder symptoms. So it doesn't mean that you don't get it. It just means that you have milder symptoms from what you would get. Children receive their very first vaccine in the United States at birth. So and then it's 12 hours. Hep B is what they get within 12 hours of birth. So there has been question about whether MMR, the measles, mumps, rubella vaccine, has been linked to autism. And as far as we know, Dr. Wakefield, Dr. Andrew Wakefield actually, falsified his data about having that link to autism. As a result, all of that happened back like in the 90s was discredited, and he actually lost his medical license, and indeed there has not been a link to autism from the MMR vaccine. Germs like the cold and flu virus, they are very benign in adults, but they can cause some significant problems in young babies. So we do really want to have like a safety protocol in terms of caring for infants. Again, that was like washing hands, before, after meal prep, before, after diapering, when you're outside. Make sure to cough in your shoulder, just being really cautious about those things. So I hope this has been helpful, and I will look forward to seeing you again. Okay? Bye. Good luck on your quiz.